This week's programme for government promises to deliver 100,000 more GP appointments. But Public Health Scotland says that over the past year there were 500,000 fewer GP appointments than in the year before John Swinney became First Minister. BMA Scotland says the SNP's pledge is equivalent to just one extra day of appointments, an increase of less than 1%, and that's if the SNP even delivers it. Public Health Scotland data also reveals that in the first 3 months of 2025, the number of GP appointments was the worst on record. The SNP's programme for government is a pathetic con. Is the limit of John Swinney's ambition to undo a small amount of the damage inflicted by John Swinney?
First Minister.
So the programme for government set out the steps that we are taking to expand capacity within the health service to meet the demand for appointments with GPs. Yes, it includes the delivery of 100,000 additional appointments that will be available through GPs to look at particular high-risk factors such as high blood pressure, high cholesterol, obesity and smoking. But there will also be an expansion of the availability of Pharmacy First services, which are designed to meet healthcare needs of individuals where relevant, and also includes the expansion of the availability of allied health practitioners within frontline healthcare services, with a commitment to expand the funding available to primary care services as a greater proportion of new NHS funding. The combination of these factors will make an impact on the access to GP services in Scotland.
Russell Findlay.
So after 18 years of failure, John Swinney is now desperately trying to clear up the mess that his government has made. Now, BMA Scotland says that government rhetoric is failing to match reality, and the Royal College of General Practitioners of Scotland say they, quote, simply don't have the workforce capacity to deliver the 100,000 extra appointments. The way to increase appointments is to increase the number of GPs. The SNP promised 800 more, but that hasn't happened. They constantly make big pledges about the NHS, but always fail patients. The SNP never keep their word. So why should anyone believe John Swinney will keep his latest promise when the SNP break them all the time?
First Minister.
First of all, Presiding Officer, the number of GPs has increased. In 2017, there were 4,904 GPs. There's now 5,211 on latest statistics. The second point is that the government is putting in place arrangements on the 100,000 appointments as a consequence of negotiating that agreement with the self-same organisations that Mr Findlay has referred to. So what the people of Scotland know from my government is that we are absolutely focused on delivering on the issues of concern to the people of Scotland. Part of that is about improving access to the National Health Service, and as I set out to Parliament on Tuesday, this government is absolutely focused on delivering on the people's priorities.
Russell Findlay.
He says he's focused on delivery, he's focused on spin. Now let's look at the SNP's record on the NHS. They published an NHS recovery plan at the start of this Parliament. They claimed it would, and I quote, drive the recovery of our NHS not just to its pre-pandemic level, but beyond. Now, my party quite rightly condemned Humza Yousaf's plan as embarrassingly thin and flimsy, and it turns out the SNP agreed with us. We now know what Nicola Sturgeon really thought of her government's big plan. She said, and I quote, "My specific concern is that it's awful." For once, Nicola Sturgeon was right. Now, John Swinney was COVID Recovery Secretary at this time, so he must have had a view on it too. So what words would he use to describe it?
First Minister.
President, I don't think it's a particular revelation for Parliament to hear that the Conservatives condemned something. They condemn absolutely everything. They've got nothing. They've got absolutely.
Let's hear
nothing.
one another.
They've got absolutely nothing constructive to contribute to the debate. So let me just say to Mr Findlay that Under my term in office as First Minister, we promised to carry out 64,000 extra appointments by the end of March 2025, and we didn't do that. We didn't do that because we delivered 105,500 extra appointments and procedures over that timescale, and we will deliver more in the forthcoming parliamentary year. So let me just say to Mr Findlay, so that he's not worried about this in the future, there will be more delivery by this government in the course of the next 12 months, and I'll be very happy to answer parliamentary questions about that, not just before the election, but after the election, when I remain First Minister.
Russell Findlay.
It was a simple question, but I'm not really surprised that John Swinney isn't prepared to come clean about what he thought at the time, because this is a dishonest government addicted to secrecy.
Mr Findlay, let's carry out our business in a courteous manner.
We saw this when Nicola Sturgeon and John Swinney deleted their messages that should have been provided to the UK COVID inquiry. We see it with the SNP wasting taxpayers' money on a shameful cover-up about their NHS recovery plan. They spent 4 years hiding the truth from the public about what Nicola Sturgeon really thought. Humza Yousaf's plan caused waiting lists to rise, not fall. It was flimsy rubbish, as we said. Nicola Sturgeon and John Swinney both knew. But the SNP hid the truth from the public, so Humza Yousaf failed upwards. John Swinney helped Nicola Sturgeon's awful Health Secretary become an awful First Minister. If the SNP had been honest and transparent, would Humza Yousaf have become First Minister?